Committee, which will be a hybrid meeting conducted remotely via WebEx and physically in the Council Chamber, J Road, Strabane, on Thursday, the 16th of October 2025 at 4 p.m. So move just to attendance. So Alderman McMorris.
Here, Karen.
Alderman Montgomery is online. Alderman Wilkinson.
Online.
Councillor Lillian Barr. Councillor Raymond Barr. Councillor Boggs.
And Shaw, Karen.
We have apologies from Councillor Clark. Councillor Deeney.
Boyle, wrong lit.
Okay, Councillor Devine.
And Shaw.
Councillor Duffy is online, I see.
Online.
Councillor Hutton.
And Shaw.
Councillor McDaid.
Here.
Councillor O'Farrell.
And Shaw.
And Councillor Tierney.
Here.
Thanks, members.
Members, I'll read the broadcasting statement. I would like to remind everyone present at this meeting in the chamber or in attendance remotely that this meeting will be broadcast live to the internet and will be capable of repeated viewing. This broadcast may be terminated or suspended in accordance with our protocol. Due to your attendance at this meeting, you are consenting to being filmed and to the use and storage of those images for broadcasting or training purposes and for the purposes of keeping historical records and making those records available to the public. Members and approved speakers are reminded to only have their mics and cameras on while speaking at the meeting and to use the chat facility to highlight a request to speak. A copy of the Council's privacy notice may be found on the Council website. So we will take declarations of members' interests. You can declare those now, or we can do them as we go along. Up to yourselves. Move along. So the first item on the agenda today is our deputation. So I would like to welcome Helen, Jimmy and Karen here in the chamber today to deputise. We also have Father Brian Darcy online, I think. Father Darcy, you're very welcome if you are online, and we would just request that you use the chat facility as well whenever you're looking to speak. So all of you are from Save Our Acute Services campaign, and you are all very welcome here in the chamber today to give us all a presentation, and the presentation should take up to 10 minutes, and then we will open the floor then to questions. So the floor is yours, away you go. Thank you.
First of all, can I say thank you for the opportunity to speak today. I want to introduce ourselves just as a campaign group very briefly. When we formed in October, 3 years ago, October 2022, we were uniquely focused on problems that had become apparent in Southwest Acute Hospital. It has been 3 years of information and discovery, and we are very aware that the impact of what is happening in our hospital is being felt severely in your hospital as well. And this is a trust-wide issue for us and has been for quite a while. And that was very much something that we did share with the Mayor and the Chief Executive when we met in August. So we're delighted to have the opportunity to chat with yourselves. I hope I do this in time now, but I think, first of all, we wanted to say that we sincerely believe that SWA can help to solve problems, which are clearly right across the Western Trust area at the moment, and they do affect not uniquely SWA, not uniquely surgery, and they very much impact Altnagelvin and OMA as well. SOAS began as a campaign just for the long-term sustainability and the future of acute services in Southwest Acute Hospital. We were primarily focused around ensuring that emergency surgery was returned to the hospital. That does remain our focus, but I think it also has to remain part of your focus in the longer term. We realise it affects the entire trust. I have spoken at this stage to well over 500 patients, staff from SWA, from NIAS, from the Western Trust, from Altnagelvin, and from our own council. So this is our first opportunity to engage with you folks. As a campaign, we focus on the public, the patients and the staff well-being. We know that the current working situation in the trust we consider it's not sustainable. And we're aware of the direct and indirect complex effects that that's having. Next slide, please, Colette. This is just a very quick timeline, and oh, wait, going on the next one, sorry. Very quick timeline. It's fair to say that SOAS and all in our community were very shocked at the beginning of this summer, which might seem very silly to think that something that was temporarily closed was going to become permanently closed. But we had been assured that everything was being done to fill the appropriate, significant surgical posts at SWA. So there was an outrage and a shock across the community. There are common issues for Altnagelvin and for SWA. I don't need to tell you these, but I have to tell you these. You know them already. Altnagelvin Emergency Department was already overwhelmed, and that's not any comment being made about it, but physically it is not designed for the numbers it's dealing with. There is a serious insufficiency in ambulance capacity across Northern Ireland, but particularly complicated due to the extra demand since the suspension of surgery in our hospital. There aren't enough permanent, settled staff at every level. And those are deliberate words. There is the unsafe practice which happens on a daily basis in the trust at the moment, where patients are asked or advised to make their way to meet surgeons, to go from SWA in a private ambulance or more dangerously in their own cars. There is currently 20 realigned beds in Altnagelvin for southern sector surgical patients. So without a doubt, this is the key issue. We are related. Our problem is the same problem. And we do want to impress on all of you that the transfer of increasing the number of patients up the road to Altnagelvin is not in anyone's best interests. This is not an Altnagelvin versus SWA situation. We are all losing here. We think it's best to illustrate the issues, or I felt it was easiest to illustrate the issues through sharing a personal experience of mine. So I'll give you some details about my father's admission to Altnagelvin. In March of this year, he was in Northern Ireland Ambulance Service. He was in Altnagelvin, and he then was repatriated eventually to SWA. And I will quote in this from a letter that I sent during his admission to the Royal College of Nurses, to the Chief Executive of the Trust, to the one of the directors of the PHA, and to the Chief Executive of our QIA. And I didn't write it as a complaint. I wrote it on behalf of the staff. And the rest will evolve in this next section. My dad had a life-threatening intestinal bleed, upper and lower, in his home in Enniskillen in March this year, on the 9th of March. He was taken to resus in Altnagelvin Hospital by the only paramedic NIAS crew that were on cover for the southern sector that night. They did tell us when they lifted Dad that had they been offloading a patient in Altnagelvin, they wouldn't have got there in time. So SWA is 2 minutes from my dad's house. The ambulance took 2 conservative hours to get to Altnagelvin, literally driving past the front door of SWA. And my sister drove myself and herself in the car after the ambulance, and we followed in eerie silence because we realised there was a serious likelihood he was dead by the time we got there. Having spent 5 weeks, and it was 5 weeks for Dad to stabilise, there were many occasions where we heard the phrase, don't worry, if he bleeds again, we'll have him back in theatre within 15 minutes. So my sister and I didn't leave the building. The Altnagelvin staff were incredibly helpful, to that extent, incredibly helpful. And I have to say from the outset, I should have opened with this. We can't say enough about the frontline staff across this trust. They don't deserve the conditions they're working under, and we appreciate every single hour that they continue to put in for all of us. So specifically, having been on those 5 weeks all the way through Altnagelvin, specifically in 3 wards also in SWA, it is terrifying to see the staff so poorly and severely depleted, reliant very heavily on agency nurses and university students from the Ulster University. These are not my thoughts. They are facts that I was given and told by staff in all of the areas, in all of the departments, diagnostic staff, ambulance staff, ward staff, and on some occasions, even management. The nurses in Altnagelvin specifically are running consistently at far less than the recommended staffing quota on an ongoing basis. It was particularly obvious at night time. Often 50% under the safety levels of their guidelines for emergency surgical patients. On one occasion, on one of the nights in March when Dad was in that ward, there were 10 patients from Fermanagh and South Tyrone in the ward. So it's not 1 or 2, it's an awful significant number. But the staffing at night when Dad needed blood transfusions, and he had 18 of those, when he needed those, he needed associated monitoring. It was just not available. The staff were so run off their feet that they did not have time to do the appropriate care and monitoring, not only of Daddy, but of all the other patients. Staff repeatedly told us that they were doing their best and that they were escalating their concerns regularly, but they were being ignored. And that's a very hard phrase to hear. On occasions, when Daddy was dangerously ill, staff came in and I pointed out and told me, I said I was part of this campaign, that I was seeing firsthand what was going on in Altnagelvin, begged me to shout, to keep shouting, to shout to politicians. And in the heat of the moment, I shouted back that they needed to as well. And then they told me that they did, but nobody was listening. So I really find, I'm petrified when I think of what must have been happening to the rest of the ward for whom nobody was able to shout. One nurse on one occasion, one long night, they had 2 escalated beds, so they were dealing with 30 patients. There was one nurse covering 12 patients, and the 2 other nurses had to cover them all. One of those was a bank nurse. She was a bank staff member. Many of those people we spoke to over those many days, and the bank staff have talked about the lack of permanent posts, which leaves them unable to settle in the area. It means that they're not a permanent member of the team, and therefore they're not aware of the nuances of what's where in the wards. So they have a limited ability to do the same as core staff would have. So I have had significant conversations with a number of nurses and managers and doctors who told me that they raised the issue of understaffing on the wards with senior management. There was one example, and I could give you many, just with this particular one. There were 2 very young staff nurses. One was a student, and they were put in a position of high risk care. They didn't realise the impact of the care they were given to Dad, and they had left him sitting on a chair where he had a traumatic bleed, a catastrophic bleed. He lost a litre of blood. Luckily, I was outside the door and Daddy managed to make a noise and had lost consciousness and collapsed. The young nurses were at the far end of the ward because they didn't realise the seriousness of what was there. So I am scared, and I use that word. I know the health minister used it this week about the strike. I don't feel that. I'm not using it for that reason. I am scared for patients in the trust because I have no doubt that many patient outcomes have to be adversely affected by the pressure that the staff is under and the inadequate and the appropriate staffing. And I want to appeal, this is my last sentence on the slide, but I want to appeal that that kind of overwhelmed care can never become normalised. It can never be acceptable for a caring profession to be able to say, this is all we can do now. And I think we have a responsibility to tell that, but I think everybody needs to take the responsibility. But it was very insightful, just that particular episode. Thank you, Jimmy.
Thank you, Helen, and thank you for the invitation to come here. I'm Jimmy, and I'm from Save Our Acute Services, obviously, as well. I'm just going to run up through the remaining slides, just with what's a positive message about what we're trying to add into the situation here across the Western Trust, specifically. Can we just go back one slide? Is that okay? We often have a concern here that the actual distances involved in travelling from the southwest, from the SWA catchment area up to Altnagelvin, isn't fully understood, especially east of the Ban. Okay, and that they tend to make decisions, I think, that where we feel if they appreciated the full distance, that they mightn't make the decisions that they're actually making. The slide at the moment shows that it takes the same length of time to travel from Letterbreen, just outside Enniskillen, to Fermanagh, as it would take to travel from the new bus station in Belfast to Beaumont Hospital in Dublin. Now, that's a sobering thought. I'm not sure how many parents of family members in Belfast would be happy to have their loved ones to have to be brought as far away as Dublin to get emergency treatment. So we just make that point. Next slide, please. We have worked very hard on developing what we think is a positive potential solution. That's our Save Our Acute Services roadmap. It's called SWA, an integrated roadmap. It's integrated in that it looks at how SWA and Altnagelvin and OMA can all work together very, very closely in terms of delivering all the key surgical work that needs to be done here. Okay. It does emphasize slightly the geography, the rurality, and the distances between SWA and Altnagelvin, which is very significant. Very important to realize there's spare capacity in SWA that hasn't ever been used. There are 92 of those one-bed ensuite bedrooms that haven't ever been opened at all. There's 2 of the 5 theatres have never been commissioned. So there's a very significant element of unused infrastructure in SWA that is available to help out, we believe, with the overall waiting lists that are currently crippling the health service across Northern Ireland. In the document, we present a case why there should be a special status for SWA to be able to help with this waiting list work, as well as being able to deliver that key local emergency care, that we should be classified as what's called a rural area hospital, and that there should be a special designation, and it's very reasonable at the moment across most of the developed countries to give extra incentives that recognize those specific rural elements that need extra support to be able to survive on a sustainable basis. There's also the element, SWA was also built on the basis of north-south development of work, and that has never been kicked off so far at all. So we see there's a very particular gap there. The roadmap itself is focused around developing that surgical capacity, both from overall Northern Ireland, but also from north-south, and that's a key factor then to enable SWA to be more of a factor in terms of working properly with Altnagelvin and OMA. Okay, next slide, please. This slide is very simple, and it just shows that if we had the extra 92 beds in SWA, the amount of extra capacity that it can bring to bear across Northern Ireland, okay? And we feel that it makes a compelling argument, okay, that must call for a real commitment from the Western Trust to look at this spare capacity in SWA. It's really significant, and it's really important, okay, that in a state-of-the-art hospital that we've got 92 beds and 2 theatres that haven't ever been commissioned at all. If we could move on to the next slide. Yeah. This statement here speaks for itself. The recent intervention by the Health Minister to advise the Western Trust to pause their consultation shows the power that the Minister has. The Trust have stated they will do exactly what they're told by the Health Minister, which includes reopening and re-establishing the emergency general surgery service in SWA if told to do so. And that's a fundamental key from our campaign in terms of trying to drive change. Next slide, please. Thank you. There are many tragic stories with regard to what's happening at the moment with regard to patients being brought up from SWA up to Altnagelvin for surgical treatment. For what should have been a simple gallbladder procedure for Mark to have resulted in such a catastrophic situation for both him and his family, it has to be something that we all learn from. Mark has been more than 7 months in on life support in Belfast as a result of having to wait too long in an ED without getting appropriate treatment for a gallbladder solution. That was in Altnagelvin, unfortunately. SOAS has documented hundreds of patient experiences. We've also talked to so many members of staff who tell us of their day-to-day experience of trying to deliver care in almost impossible circumstances. This is both in SWA and Altnagelvin and in the ambulance service as well, which is very, very strained and stressed at the moment. We just can't let this continue. Just next slide, please. And I think this is the last slide. We can say that we've got very, very strong support to date from Fermanagh and Omagh District Council, for which we're very, very thankful. We had a constructive meeting with your chair and your chief executive in August. We think with your mayor, sorry, I know, yeah, we don't have a mayor in Fermanagh and Omagh District Council, unfortunately. And we're keen from the point of view of our campaign, if we can, to build collaboration and cooperation with the Derry and Derry City and Strabane District Council as well. We think it's very important. These are linked issues. I think it was on one of the earlier slides. This isn't a zero-sum game. Okay, what's bad for us in a SWA is also bad for you in Altnagelvin. Okay, and we think that if, in particular, we can take a look at the roadmap, that we can work together to try to improve things going forward. Other than that, I would just like to thank you for your time today. Okay, and we're happy to take questions. Thank you very much.
I'll forgive you. Thank you very much for the presentation. I'm going to open it to the floor, but just to say a huge thank you for the resources you've brought here today as well, so that we can all take a look at some of the stuff that you're chatting about. But thank you, Helen, for sharing your personal story as well. It's not easy to go back and relive something and try and explain it to all of us. But you did talk about the commitment from the Trust and the staffing issues. So we have received correspondence from the Trust, and they want to come in and have a meeting with the committee as well. So we will be organising that and keeping those conversations going and communication lines open. So just to put that on record with yourselves, the Trust will be invited along as well. So I'm going to open it to the floor. First, I see with a hand up is Councillor Devine. Go ahead, Caroline.
Good Chair, and thank you very much for coming along today to present us. And Helen, thank you for sharing your personal story. I know that's not easy. I'd like to thank the group as well, I suppose, for their tireless work representing the views of the people of Fermanagh and South Tyrone. I represent the Castlederg area and Ahern, and I suppose we would align ourselves very much with the SWA. So I just wanted to state that from the outset. I think our rural communities deserve to be heard. And as a party, Sinn Féin have been continuing to work to ensure that everyone gets fair access to healthcare, no matter where they live. So the closure, I suppose, was 3 years ago, and that was to be a temporary measure. And unfortunately, now here we are 3 years down the line, and that service still hasn't been returned. And I think that decision has real and serious consequences for families across the area, particularly rural people. And I suppose it means that patients who were once safely treated in Enniskillen now have a lot of travelling to do to get to Altnagelvin. It means longer waits. It means an added strain on the system and on staff, as you've already alluded to. And I suppose a reliance on ambulance transfers for patients that are seriously ill. And that could mean, as you've already stated, a 2-hour journey. And that could be the difference between life and death. And I think, I suppose, we're also talking about distance on rural roads, which are a very different network, as people who live there know. And so here we are down the line. There's no plan, there's no timelines. And I suppose that means there's no reassurance for communities. And our party has been calling for a number of different actions, that the Trust publish a clear and a detailed vision for the future of the SWA. And I know we've had a response come back in from the Trust that they are going to start a people in place type of visioning for the service. I think we need timeframes around that. We need staffing plans, we need service guarantees, and we need a model for rural healthcare that works for the people and it serves the people that it's serving. We'd like to see published evidence that justify the continued suspension of emergency surgery in the SWA, and also a guarantee that the SWA will remain a fully functioning acute hospital with all of the essential services that go with that, and proper engagement. So we want to see proper comprehensive engagement with everyone that's impacted by the decision, with the people in the area, with the clinicians, with staff, with unions, with elected reps, and with the community. And that needs to be done in advance of any decision. I think we all would agree that we do not want to accept a 2-tier system where rural communities are left behind and are expected to travel for hours for emergency treatment. So again, I just want to say thank you for coming in and presenting to us today.
Yeah, go ahead, Helen.
Thank you for that, Caroline. I just wondered, coming up the road, actually, our local council has health committee meetings quarterly, and the Trust attend all of those and have done so since October 2022. Is the, like, I'm not asking you all, but, you know, I'm not sure, is the engagement the same at this area of the Trust, or is it different? Is it less than that? Because I do think they're probably, for all of us in Fermanagh and in Omagh, we naively for a long time thought it was just about us in Fermanagh and Omagh, and it's very much not. And I know that our councillors received, for example, a representative's brief from the Trust in June about the temporary becoming permanent, and they then received a more detailed document this week when they brought forward their vision statement. But the concerns I would have with what they're proposing to bring forward are that the minister, the words that he used was that he wanted it to be at pace and to use the time currently, to use the time, oh, wrong page, sorry, to use the time to move forward, to rebuild trust and to bring this vision forward to him. When we've read the small print on what was presented to our council, we can see straight away that the vision for Fermanagh and West Tyrone to include SWA should be carefully approached and could take a considerable period of time. That just fills me with more fear. It does not make me feel there's anything sincere about this process whatsoever. And also the points to note, there are 4 policy documents named at the end of the brief that our council was given. And again, I'm going to assume you have it, the same brief, that you do have it. And if you don't, obviously it's on our council website. But the first policy document that they're going to consider in moving forward in this protracted process is the hospital's network document, which, as you know, will leave Atnagelvin as it is, overwhelmed, as well as being the area hospital. We don't want to be an area hospital. We are going to look at being a general hospital. Being a general hospital would mean that the services inside our hospital would predominantly be decided on the autonomy of the Trust, not by ministerial powers and laid out like that. And Omagh would become a local hospital, which is it's a TLC insult. It's dreadful, to be honest. But our concerns are that our roadmap was adopted formally by Fermanagh and Omagh District Council as their vision for SWA. It was also adopted by, we've been rolling this out for the last 7 months. I'm not sure of which parties are where, but the SDLP in Northern Ireland have adopted it completely as a document. full support. The Ulster Farmers Union across Northern Ireland has accepted it because of the rural aspects, again, Caroline. We also have 50 large employers, 50 businesses. And I mean, those are, you know, business leads for over 25 people. They're heads of industry, they're heads of factories and so on. We have the GAA in its entirety. We have Fermanagh Grand Orange Lodge. We have the all of the soccer in the Fermanagh and Western League, which obviously does affect that in the Galvin area as well. But all of those people are standing behind the roadmap and saying, this is what we want. And we did send it to the Western Trust and present it. In fact, we had a meeting, which I attended in the car park at that time in Galvin. The meeting was to be with the Department of Health and the Trust Management. So I linked in from the car park. Jimmy and Father Brian were in the room, but there were comments made of understanding and acknowledgement. And Neil Guckian, actually, one of the very clear moments in the call for me was that he said that he is fed up asking the Department of Health to reinstate the 92 beds and all 5 theatres, but he hasn't done it. So, I mean, you know, talking the talk is one thing, but at this stage, we don't accept, if we're left for another 2 years while they meander around creating a vision where there's a very, very sensible document which lays it out step by step by step, and it only begins with a commitment to reinstate 6.5 old-time equivalent surgeons which were to be in our hospital. That's a substantial saving of money, time and effort. And I do feel it's not going to come out with anything appropriate for any of us at a level that we need. And I kind of was coming down the road and I was thinking, if SWA had its 6.5 surgeons again, where would you see the gain? And these are a bit random, but they are my thoughts coming down the road, scribbling. Your ED, you will see a difference in your ED. There are just short of 8,000 people who have come up according to the Western Trust infographics. There's just under 8,000 people who have, because there's no surgeons in SWA, made it up the way to your system. You'll feel the difference in resus. I've seen how that works. I mean, they haven't got enough beds. They were moving people in and out and whatever. It's crazy what's expected of them. One of them, trauma cases. If we have a trauma, which is a car accident, a farm, an incident, whatever the heck, it could be very small. It can be very small. It can be a complex sporting injury. But if we have a trauma incident in our area, we have to be stabilised here. Predominantly, there's 3 reasons we can go to SWA, but that's it. But one of the ones that I thought of coming up the road is, it's very banal, but it's very real. Falls is a service in Northern Ireland for patients who are over 65, who are considered frail, and it's getting uncomfortably close to my age, but over 65 is where it starts. But if somebody falls in Fermanagh and needs pins inserted, as an example, they come to Galvin automatically because Falls has been removed from our county, just County Fermanagh. It was temporary County Fermanagh and Tyrone, or no, yes, Fermanagh and Tyrone, but it is now completely and uniquely the only county in Northern Ireland that doesn't have a Falls service, which will patch up people after a fall, bring them back to their own home and support them back to health. But what happens us now is up to Galvin, they'll not get back to SWA because of delayed discharges in SWA. So we're clogging up your wards at every level with no alternatives. That's all I want. Sorry.
Thanks very much, Helen. The next indicated speaker is Alderman Hussey.
Thank you, Chair. I'm not a member of committee. I appreciate the opportunity and I welcome you. I note going forward that you have stated you have very strong support from Fermanagh District Council. I trust that you will realise that when you leave this meeting, that you have very strong support from Derry City and Strabane District Council. I'll declare a slight interest because I have family members working within the Trust in medical, domestic and indeed administrative roles within the Trust. Like yourself, I'm going to relate a story that happened to me 3 weeks ago. I awoke, found myself, I said, I'm very ill, I need to get into hospital. My wife went online, and I live in Castleberg, by the way. My wife went online. The waiting list on E&A at Gavin was 123. I was taken to SWA, taken straight in and put straight onto oxygen. So, the whole system needs to work together, a combined system. And that includes Oma Enhanced. And I'm sitting here with a sort of a deja vu because I was about when TCH was closed. It was death by 1,000 cuts, is how I described it at the time. I was in MLA for West Rome at the time. And I described it that way. And I feel that this is the sort of situation that Southwest now is finding itself in. And it has to be reversed. I totally support your discussion paper. And it is that, and it has to become an action paper. And I have engaged with the Health Minister face to face on the issue. I know others have from Fermanagh, South Tyrone, Fermanagh, Oma Council. I think it's important that the Health Minister realise, I mean, he's a Strangford man. And you talked about, east of the Ban, west of the Ban, and that's the scenario we're in. Those folk up on there do not understand the situation in the west of the province. We don't have a health committee as such, but as has been pointed out, I think it was Caroline said that we will be meeting with the trust. And by the way, I don't trust the trust, because the issue that I have with the trust is Altnagalvin is the jewel in their crown. And that was the scenario when Tyrone County was closed. And I feel it's still the situation now that has to be dealt with. Another factor that you haven't mentioned that I have heard is coming will impact is I believe that emergency services at Letterkenny are under threat. That is going to also impact on Altnagalvin. It's going to impact on them. So it has to be a joined up service. And indeed, I will say it as a union, a north-south service. That already exists within some of the services at Altnagalvin. There's no reason why it cannot exist across the entire northwest, southwest area, because that is the nature of our boundaries. But be assured of our party's support in this council. Be assured that from a party perspective, that is being taken directly to the minister. I think SPAD is well aware of it, as you will realise. And I don't think there's much more I can say. It's a horrendous situation that is being placed on the client base of the entire Southwest, and it has to be addressed. And look at the map, and it's clear what the scenario is. Thank you for your presentation, but as I say, be assured of support.
Thank you very much, Alderman Hussey. And next indicated speaker is Councillor Tierney.
Thank you, Chair, and thank you all for your attendance here today. I'm glad that the presentation started off, Helen, with you outlining that this isn't Altnagalvin versus SWA, and it's going to impact on all of us, because I think that's the message that we have to get and make clear. There were some very interesting points within the slide, some which, if I'm going to be honest, alarmed me. The simple fact that people have been asked to use their own cars to transfer is completely dangerous, to say the least. And I think that is something that we're going to have to raise with the trust whenever they do come to meet with this committee. And I know one of the slides, in terms of the geography, pointed out and made the point that would patients in Belfast be happy to travel to Dublin for that 1 hour and 44 minutes, I think it was, journey? And they wouldn't be, absolutely. For me, as a dairyman, I sort of transfer that and go, would I be happy to travel to Belfast for emergency care, which is only an hour and a half? No, absolutely not. And why would we expect patients in Fermanagh to have to travel 100 or an hour and 44 minutes for emergency care. Jimmy, you did point out that there were services that were never used in SWA, and the north-south element of that wasn't working. I wonder, could you go into that in a wee bit more detail for us? But I suppose from an SDLP perspective, just to point out, and Helen, you've already touched on it, we have supported and endorsed the roadmap, and that is something that we will continue to push alongside with yourselves to try and get the services reinstated. I think the health minister's decision at the time to pause was a good idea and a good suggestion, but I think now is the time not to on pause, but to restart, and restart with better public engagement, because we can't just allow emergency care to depend on your postcode, and that's currently what's happening, and that's not good enough, and we can't leave rural communities abandoned. Now, you may be aware that our health spokesperson, Colin McGrath, MLA, has put pressure on the Stormont Health Committee to come out and visit the SWA. So as I understand, their next meeting is going to be, the committee's next meeting is going to be in the SWA, so that MLAs from across the north can see the services there, and can discuss it, which I think is a good idea, and something that we definitely should be supporting. I think when we look at how the alleged consultation process was done, and there was a conversation on this committee, I think it might have been before Christmas, if I'm not mistaken, around the fact that the Tyrone element of the trust, there was no consultation in that area, but there was going to be one in Derry. That's alarming in itself. So I think the trust and the health minister should be working with campaigners, not against them, and trying to design a way forward that works for everybody, that works for people in Fermanagh and works for people in Derry, because the current system, as you have very, very clearly outlined, isn't working for anybody. And I think that that's a problem. In one of the last slides, and Alderman Hussey has pointed it out, you've clearly stated that there was good, strong support from Fermanagh and Omagh District Council. And I have, over the last number of weeks, been speaking to my party colleague, Adam Gannon, who sits on Fermanagh and Omagh Council. Now, I understand that they endorsed your roadmap as a council, and that they also took a proposal to write to ministers at the executive to call this decision in. And I would propose that we as a council do the same, because we as a council are also going to be impacted by that. And if it can be, decisions, and I'm not criticizing why decisions are called on or what decisions are called on, but some decisions that are called on aren't as important as this. And this impacts hundreds of thousands of people across the West. And I think it's something that we should do. So, Chair, with your permission, that would be a proposal that I would be willing to make today, that we endorse the roadmap as a council, and that we join with Fermanagh and Omagh District Council to write to ministers at the executive asking for this decision to be called on and discussed at the executive, in line with Fermanagh and Omagh District Council's already endorsed proposal. Thank you, and thanks once again for your attendance today. Thank you.
Yeah, Karen, go ahead.
Thank you very much. It's very reassuring to hear that you're supporting the situation that we find ourselves in. There's a few areas I'd like to go back to with your previous speaker as well. As a consultation, consultations are supposed to take place, and in my understanding of them, that should be a two-way process. We have engaged in numerous consultations, really right from the start, as soon as the temporary suspension was brought in. We had representatives, members of our area voted 30,286 votes first, or petitions for the temporary suspension. The Department of Health's bariatric consultation, we have actively tried to get bariatric surgery back into the elective, producing new specialties to encourage doctors to come back. 19,000. The roadmap, our local members are 28,494. This is a really big red flag. In Northern Ireland, any of the consultations that have taken heretofore place with the Department of Health, we have had the highest response ever recorded in Northern Ireland. Our response to RQIA in relation to the review has been the highest response that they have ever received. This is a red flag, and for the Trust, unfortunately, to come in with the consultation and go ahead with the permanent removal is a really direct and demonstrative action that we are not being listened to, which is really important. Second part is, maybe I'll just take you on the geographical situation. I'm going to, this is the second and third point. The second point is the geographical situation. A lot of infrastructure and planning that happens in Northern Ireland is identified through other policies and procedures that are in the UK. And they don't assimilate well. They don't cross over well into Northern Ireland for a variety of reasons. But the fact that we are travelling, for me, it's a 2-hour journey to Alpengavin from where I live if I have an emergency situation. In the UK, 84% of the population live within 7.4 miles of a major emergency department. That's how strongly disadvantaged we are. And our roadmap, not only does it want to bring back emergency surgery, that is the priority, but we must integrate that care again in relation to Alpengavin. Now, my final point to cover is there is a similar scenario that has taken place in the south of Ireland, and it's been very public in the last week. And it's a hospital called Limerick University Hospital. And unfortunately, we can look, there's a real immediacy here, but there's also a long-term position for Alpengavin, because they were in a similar situation. In 2009, there was reconfiguration of services in Limerick, and they closed some of their smaller emergency departments. So they all fed into Alpengavin, or they all fed into Limerick. As a result of that, in 2017, they built a new emergency department. 1955, their emergency department was built. 1960, I believe, in Alpengavin. They reconfigured that department completely, modern department, and they have the highest level of overcrowding in the south of Ireland permanently for I don't know how many years now. They recently launched and opened a new 96-bedded unit in Limerick. It still has the highest level of overcrowding. It has planning permission for another 96 beds, and there's discussion on the possibility of developing actually a new hospital as a result of this. So the reason I'm bringing this to everybody's attention is that with the best will in the world, once you lose that service, the chances are that you're going to play catch up for a long number of years. I know, and I listened to your health committee report in July and the discussions in relation to your, hopefully, the transformation of your emergency department here, that the money would be made available and that will be upgraded. The recent 96-bed opening in Limerick cost 103 million recently. That's only 96 beds. We have, like Jimmy said, 92 beds, 2 theatres that have never been used, 3 that are underutilised, and the capacity, what hasn't come out publicly in a lot of the meetings we've been having is that while Limerick have increased their emergency department and they built a new one, they ran into a conduit that the reality is they could see the patients in the emergency departments, but where did they go then? There was no capacity. So capacity is a major problem for Alpengavin, and we are a really significant solution to that. With 92 beds, you don't have to spend 103 million. And with when you see the prohibitive costs, the planning applications, the prolonged issues that where you go into any building project now, that's a real concern. When Limerick developed their new emergency department, they increased their size 3-fold. The new emergency department, what I've heard for Alpengavin, hopes to have a capacity for 100,000 patients. My understanding, you're at ready a capacity for 70 to 80,000. With an ageing population, an increase in population, you're probably going to go past that threshold very quickly. And this is what Limerick has happened. They have played follow up ever since. And it's a major issue. Again, the highest overcrowding even with the new services, the new resources and the additional capacity. So I think we have a really massive positive opportunity to integrate care between OMA, between Altnagelvin and SWA, that we can bring a better delivery of care, cost benefit as well, that we're not going to be spending. Now, the other thing that will increase is that if we can take that pressure of Altnagelvin, the reality is the money that will be needed for additional new and emergent medical services, etc. Well, you'll have the opportunity to develop that. Nobody has an issue. From people in Fermanagh have been travelling to Altnagelvin, and we have been very grateful for the service that Altnagelvin has offered us as a community for the last number of years. But we can't travel for emergency surgery. We just can't. It's not possible. So that's, so the overview of giving you that journey of where Limerick it's been very public in the public arena this week. That's a future, that's a real concern for Altnagelvin. And like I say, 92 beds and 5 theatres, we could do a lot of work and do it very efficiently. So thank you very much. Thank you.
Thank you very much, Karen, for your input. So the next indicated speaker is Alderman McMorris.
Thank you very much, and thank you, Helen, Karen and Jimmy, for coming on today and what has been an eye-opening, comprehensive delivery. I totally agree with everything that everybody has said in this room today. And if we need a seconder for Brian's proposal, I'm happy to do that. It is disappointing when we see about what the consultation about them bringing it up and areas being left out, and then just to disregard the consultation and then to come and say they're bringing in forward a vision and plan with no end date or no goal and behind it. 3 years for a hospital to be out of service is disgusting, if I can be that frank. We see the impact it is having on Altnagelvin. You just have to go to A&E any day of the week and you'll see the impact the minute you walk through the front door. I had a very good personal friend of mine that went into Altnagelvin recently, and basically there was no hope for her, and she was put into a room in A&E, and there was people lying all around on the corridors. She had absolutely no dignity, no privacy or anything. So I totally understand when you're saying about the impact that it has across other hospitals and certainly Altnagelvin. I do agree that, your roadmap is a way forward and that we need to get behind that and basically make sure that the trust listens, first of all. And I know they have agreed to come in, but it is our jobs as elected representatives. We will be holding them to account of if they're not listening, why are they not listening? Consultation is a two-way process, and you can't say that you've consulted if you haven't listened to the views in the room. So I think that that's something that we really need to be pushing hard on, and not just to open up another consultation. Do you know what I mean? We need actions, and certainly, it's consultations is good for, feeding back and what the desires and needs or whatever is, but they have to come up with an alternative straight away. Do you know what I mean? We can't have, like, SWA is not an old hospital, it's a relatively new hospital, and to be sitting. Yeah. Yeah, and for that, like, to be sitting the way it is absolutely A, disgusting, but B, an absolute waste of public money. Do you know what I mean? And this is where we have to be challenging and saying, how can you justify the decisions that you're making? Also, like, I have relatives who live just near SWA as well, So I totally understand, even for appointments, to come down and stay overnight and whatever in our houses. You know, we should have a system that gives fair access to health, and it has to be at the place of need. You know, it can't be, as you say, 2 hours drive away. You know, we can't have a situation where you're getting on the back of cars, driving people who need emergency care. That is not sustainable. Not only is it not sustainable, but we're going to have a catastrophic loss of life, which is more important than anything else. Now, I totally understand, and the trust, you know, while they have a care for the community and a care for their patients, and I don't underestimate the work that they do, you know, but we need to get from the top down in order to make the decisions based on need within the areas. And they need to do that, you know, and the vision and map is good and well, but it's not going to help the people that's in Oma, Enniskillen, and between, or even in Letterkenny or whatever. Do you know what I mean? We need to get the geographics right and what we're placing in the SWA and making sure that it addresses a need. But I just, 92 beds, when I seen that, I was absolutely shocked. 92 beds and 2 theatres, never used, you know, and a friend of mine, she got a knee replacement there recently through private help, through the NHS, but they actually use private healthcare providers, and they moved their whole operation and, you know, the hospital. How can that be value for money? Do you know what I mean? The money that they're putting into that private healthcare, and I understand they're trying to bring down waiting lists, but that could pay for like 6 consultants, I'm sure, to bring up the services and so on. So look, I am totally supportive of your vision and your roadmap, and we need to be making sure that we're all singing off the one hymn sheet and holding the trustee account to make sure that they make decisions based on the needs of the community. And we need to make sure that they're doing that promptly and no delays. But thank you so much for your coming, and thank you for sharing your personal story as well. You know, I think personal stories is what impacts people the most, you know, and it's only whenever you have that impact yourself that you realize the detriment. Do you know what I mean? But thank you so much.
Go ahead, Jimmy. Yeah, go ahead.
I see Father Brian Darcy is online. I just wonder if Brian might want to just say something about the effect of the distance and the overall way in which the hospitals are working.
Yes, I've been, I don't know if you can hear me or not, but I hope you can. And thank you very much for facilitating this. And apologies for not being able to travel today because of work commitments here. I've been listening very carefully and been heartened greatly by the sympathy and empathy, indeed, that you're having with our position in SWA. We've been working on this 3 years, and it is having a terrible effect on the whole community. I've even had people who have said, quite a number of people actually, who have said that they needed a surgery, but that they didn't want to have to go to Altnagavin to do it, and they would rather die than do that away from home, because and a lovely hospital of their own beside them. I was part of the group who worked very hard to for the establishment of SWA. We presented a perfect hospital with each room is en suite, and the 5 theatres that are perfect working theatres, one of them especially done for bariatric treatment that has never been used. And we not only presented them with the hospital, we presented them with a business plan to help make it work, because it would be a facility for the rest of Northern Ireland, and it would be a facility where cross-border medical care could be given, and it would have more than enough to do in all of that. The problem what we have at the moment is that nobody seems to be listening to the actual case. Nobody in the trust is anyway. And what we need to work together is we need people to work together. We need politicians to work together, because we're not a nuisance group. All we're looking for is a basic health care service, which the Trust is bound to present to us. But it is not doing it, and it is taking it away from us. And it is not fair, and it is not just that a whole group of people, just because of where they live, are in danger of death on a daily basis because of the removal of acute surgery from a hospital, which in its very name is the Southwest Acute Hospital. So all of this is very difficult, but the problem is that we need to get somebody in with who can make decisions to listen to the real case. And what I would make the plea today is that all of us as the people and representatives of both areas would work together to ensure that the people's voice is listened to, that patients are cared for, and that the job of the Trust, which is to look after the patients, should take priority over everything else, and that they would really listen to what that is happening. So thank you for doing this. It is having a catastrophic effect on the ordinary people that I have to deal with in my daily work as a pastor in the health service, a voluntary pastor in the health service. And I would make a plea. Listen to what we've saying. We're not a nuisance group. We're a group who are actually trying to help the Trust to do their work. And the sooner they see that, the better. Thank you very much indeed.
Thank you very much, Father Darcy. Next speaker is Councillor Sean Harkin online.
Thank you, Chair, for letting me into the meeting, and I want to thank our guests today, and I very much support your campaign, and I think that your document and presentation here today was excellent. I also agree with the proposals that we should support your demands and add our voice to the support that all our councils have given for the campaign. A lot of stuff has already been covered by yourselves and in the questions. I just want to say a few things, which is that look, I believe that we have awful health inequalities right across the north. And what we actually need to do is expand healthcare provision in order to meet the health inequalities and try to deal with them. And the reforms that were proposed through Bengoa are actually going in the opposite direction, because what they want to do is reduce the capacity of the health service. It's called centralisation, but most people can see that it is about reducing access to care, and that's what's happening with the SWA. That's what's happening with emergency services, and I think that this is the wrong direction for us to go. And look, all the main parties at Stormont signed up for this. In a lot of ways, I think that what's happening to the SWA is the outworking of that, but that people are pushing back against it because people can see what this will mean for the locality, but what it will also mean in terms of the build-up of pressure on services in other areas that are already completely overwhelmed. So I think that instead of reducing services, we actually have to expand them. If we reduce services, it's going to actually deny people access, particularly in rural areas where we know that transport and access to everything is far more difficult for people. So these are all the reasons why we actually should be increasing what's available in as many localities as possible. And that's going to take investment. It's also going to take an honest conversation about what the Bengoa proposals actually would mean, and that they're more about austerity rather than increase in provision. I think, people have spoken about an all-Ireland approach. I think it's very clear we're a small island. We should have a completely integrated health service, and I think that will increase access and provision for the vast majority of people. So just want to commend the campaign for the work that it's done. It is forcing, I think, people who had signed up for it to roll back on it, because that's the power of people power, and also the evidence that you've presented. So thanks for being in here today, and I hope that this opportunity gives a bit of confidence to the campaign and helps it move forward.
Thank you, Councillor Harkin, and we have the final indicated speaker, I think, Councillor Boggs.
Gurmagit, Chair, and thank you very much for coming. It's been really informative, and as Aisling says as well, thank you for the resources while you've been chatting. I've been reading as well, so thank you very much for that. And Caroline has outlined our party's support for what you're asking for already, and I know that you've been engaging, or MP Pat Cullen has been engaging with the Health Minister and the Trust on your behalf. I suppose there's a proposal on the floor at the moment from Councillor Tierney, and I think seconded by Alderman McMorris. There is still a bit of engagement that we want to do with the Trust, and to be fair, we would have preferred maybe to have that engagement. We know from Ananoma have signed up to this, just given, and I think you've kind of said it yourself, they seem to have more engagement ongoing with the Trust, and maybe that's something we need to look into as a committee and as a council going forward as to how frequently we engage with the Trust. So I think maybe they've had enough time to engage with the Trust. We haven't. So I think in terms of the roadmap, we would have preferred to have that engagement first before we sign up to the roadmap. But all the same, what is asked for in here, we're supportive of at the minute. So I don't think we need to push it out. I just want to make the comment that, you know, allowing the proposal to pass at the minute isn't contradictory to any engagement that would be had with the Trust as well. And I think you have that agreement yourselves. So look, thank you again for coming on this, and we, as others have said, you have our support, and the wider issue has our full support going forward. Thank you. Thanks, Chair.
Thanks very much, Councillor Boggs. So there is a proposal on the floor and it's on the screen there.
Chair, will you allow one quick question?
Oh, sorry, Alderman Hussey, I didn't even see your hand up. Go ahead, go ahead.
It's just a clarification. It's been said to me that private healthcare does utilise facilities at Southwest. Is that true?
Yeah. Yeah.
To our knowledge, yeah, there had been a group coming in a while ago that had been using the facilities there. Just important to point out one thing about the roadmap is that it's focused around an NHS staffed solution for SWA 100%. And it's really important that that's very, very clear. As part of the elective care framework that the Department of Health, they gave an update in May of this year, and they do intend in that to bring in what they call the independent sector to do quite a lot of work across all of the day centres and the overnight stay centres that are doing this waiting list work. Now, but they also say, and it's very important, I think, that us as a community, but you as politicians follow up on, they also say that at the same time, they're going to be developing business cases to ensure that this work will in the longer term be done by NHS staff. And it's very important that we make sure that these business cases are fully developed and fully pushed through on. That's definitely the goal of the roadmap. 100% our goal is for an NHS-based solution, but that we just need to be very aware that there's a big pressure at the moment coming through what they call the elective care framework to use the independent sector more and more.
Through you, Chair, thank you very much for that clarification. I think it had to be, you know, it had to be.
Yeah, no, absolutely. Thank you.
Thanks very much. So, members, we have a proposal on the floor proposed by Councillor Tierney and seconded by Councillor McMorris. We're all in agreement? Okay, that's fine. So thank you very much. Has anybody else any further questions, comments? Is that okay? So,
Chair, just before you, I would just like to make a point. I'm conscious of who's sitting next to me, right? But I'm afraid I'm going to add fuel to his ongoing fire. But having to travel or expecting people to travel an hour and 44 minutes is crazy for emergency care. But I had reason to go to Fermanagh recently, and my sense of direction wouldn't be great, so I had the sat nav on, and it took me on through Castledare, going out over a B road. You know, so travelling an hour and 44 minutes on poor roads makes that decision even worse. And I think when we're talking about roadmaps and we're talking about the journey for the SWA, we need to actually talk about the physical journey from Fermanagh to Altnagelvin, and without adding the rural woes of this world, for me as a city boy, I seen firsthand how bad it was, and I wouldn't like to be sitting in the back of a car or in the back of an ambulance heading on that road coming to Altnagalvin and needing emergency surgery or care. I just wanted to point that
from
out. Thank
Omagh to
you.
the southwest as well.
I don't know if I was even allowed to answer, but I'm going to thank you for the question. I have to say the thing that we forget when we're counting the times in transit is the times that we've had diagnostics in SWA. We've on 2 previous occasions had family members, one of whom arrived at SWA was told this is again close family, an 85-year-old who had a ruptured appendix, diagnosed in SWA. The entirety of the trip until he got to theatre was 31 hours. The diagnosis was made within the first 6 hours. It's so literally it's not the 1.5 up the road, it's when you get an hour and a half in that ambulance. And I do think there's an interesting thing and funny, maybe it shows that people in Derry are understanding that it's not us and them, it's us, and it's all of our survival and all of our families. But there's an awful lot more context and more in print in the Derry in the papers at the moment. And one article just came up this week and I thought it was really fundamental. NIAS have a serious impact here. And I just wondered when you talked about bringing the trust in, would it be, I'm probably stepping over millions of boundaries in councils, but I'm going to throw a leg over anyhow. I'm not sure if it's possible, but I do think NIAS should be included in discussions because at the moment there's a situation that we haven't even mentioned where the Northern Ireland Ambulance Service do not accept to bring patients anymore from SWA ED to Altnagalvin ED. So there have been patients sitting since July in SWA ED for up to 77 hours was one of the cases I was told, and the situation was described to me. The staff see these people deteriorating in front of them. They're talking to people on the phone in Altnagalvin, but because there are physical people in Altnagalvin already able to be taken a place, they have to wait. There's no beds going to be freed up just because you're waiting and getting worse as well. So we have to look at how the transport works, but NIAS have pulled out of that. So if you're not going to a pre-designed bed in a ward, they're not getting you. And they've also confirmed under FOI, and I think she's a local journalist, Catherine McGinty. But she had a lovely article this week, which we shared, and the Western Trust are going out of their way in all paperwork to state that not one patient has suffered harm because of these pathways. In that freedom of information, NIAS have confirmed that they have had 35 adverse incidents involving the transfer of patients to Altnagalvin from Enniskillen Southwest Acute Hospital. Now, she goes into the detail of what an adverse incident is. We all know what it is. It is patient harm. But in total, NIAS, that article is well worth a look on our page or in if you have the paper yourselves. 236 adverse incidents were raised by NIAS and sent to the trust as an inter-trust incident. And the trust are saying not one patient has been harmed. So there is a very definite contradiction in what the ambulance service are saying and what the trust are saying. And we're also really mindful that in the infographics that the trust put up, when they talk about ambulance transfers, are they mentioning the number of private ambulance companies? Because that's the biggest growing industry that we think we can witness, certainly when you're inside a hospital, and Altnagalvin particularly because you get the cross-border ones. Sorry. I could have outstayed my welcome now, so.
Oh, you're grand, Helen. Thank you very much. To Jimmy, Helen and Karen and Father Darcy online. I think, everything that we've discussed here today, when we talk about vision plans and roadmaps, it needs to move with pace. So, what you have given as a recommendation about in relation to NIAS, I think that's a really, really good idea. It needs to be a multifaceted approach, and we're getting the opinions from all different sectors and organisations that are being affected by this. So we will be inviting the Trust along to present next month, and hopefully NIAS can come with them, because I think at the minute, what I'm gathering from this is that we should be working towards alleviating people's fears and
Yes.
stresses and anxieties. So I want to thank you again for coming along today and look forward to seeing you again at some stage. But we'll keep in touch. Thanks very much. Thank you.
Thank you very much indeed.
Chair, can I just make a point? The ambulance trust is a separate trust, so they should be invited separately to come along to that.
Well, I've just had a quick discussion with Karen. We're going to discuss that with Neil Guckian and see how that would work together or separate. But thank you for your opinion.
Chair, excuse me. Can I, just on your last comment, and I know you said you've been discussing it with Karen, can I just ask the rationale to discuss it with Neil Guckian? Why would we be discussing with Neil Guckian to invite the ambulance service to a committee? It's got no, it's not his remit, so why would we be discussing it with him?
Well, the trust are the people that are being invited and had asked for the invitation. So we'll seek their advice on whether or not they feel that both organisations, we're not going to ask Neil Guckian to invite the ambulance service, we'll do that separately. But would there be a purpose in having both together rather than doing two separate meetings when we need to bring that information together anyway? So, timing as well. Right, members, we will move on now. We will go through the agenda. So we're moving on to matters arising from the open minutes of the Health and Communities Committee held on Thursday, the 11th of September 2025. Sorry. Rewind. We're a chairperson. No. Councillor Harkin, is your hand up or is that from previous business?
That's an old hand. Thanks, Chair. I'll get it down now.
Thank you.
Chair, can I propose we take a couple of minutes just that it's after the hour and everybody, it's warm in here and I know I have chair's business, but I also need to go to the toilet. So I'm proposing, if you don't mind, can we take a couple of minutes to everybody get themselves back to square one?
Aye, because I think I need a break too. have a couple of items on chair budgets and I have two myself. So I'll go first if you don't mind. Nope. Michael.
Yep. Just having a look here.
Finance Minister Donald out today in relation to the significant investment of an additional 130. Councillor Tierney.
Chair, thank you. And just to join with you and agree that it is very welcome news, but also to declare an interest as my wife is a nurse and will likely have an impact on her. But I think it's great news and something which should have, if we're going to be honest, should have been done a long time ago. But the fact that it's been done now is something I'm sure that healthcare staff will definitely welcome. Thank you.
Alderman Hussey.
Just briefly, you did mention the finance minister, but it's my understanding that the health minister and the finance minister work very closely together to enable that to go to the executive, that the funding would be agreed by the executive. So it is extremely welcome.
Thank you, Alderman Hussey. So my second item of Chair's business today is around Breast Cancer Awareness Month. So October is Breast Cancer Awareness Month, and I suppose it's a time for us to show those affected by breast cancer the fact that we all have a duty of care to raise awareness and of the importance of early detection, research and the support services that are out there. So breast cancer remains the most common cancer affecting women here in the north. But thanks to the advances in treatment and early diagnosis, survival rates have doubled in the past 40 years. However, continued awareness and support are vital to ensure even more lives are saved. I would like to extend our thanks as a council to the many local organisations, charities and community groups who work tirelessly to support those living with breast cancer, including those who fundraise. The fundraising is a really vital part of the work that they do. Those who volunteer and provide care and comfort to individuals and families. Their efforts do make a tremendous difference to people's lives, whether or not that's people who have a breast cancer diagnosis, or how they relay that news to their young children and families. So as a council, I would encourage everybody to take part in local awareness activities this month, whether it's wearing pink, taking part in a fundraising event, or simply having a conversation about regular screening. Screening is very important. So I think that together we can raise awareness, support those affected, and continue the fight against breast cancer. Thank you very much. Councillor McDade.
Thank you, Chair. And I suppose just very briefly, just to concur with everything you're saying and encourage everybody to get involved in all the activities that will go on across the month. My best friend was diagnosed with breast cancer a few years ago, and she was only 34 and her baby was only 9 months old. So we were involved with all those kind of local charities, and even just thinking the legendary Relay for Life has relaunched this year. So not talking too much. So I would encourage everybody to get involved on it, because and I know that the money they raise, it's cancer research, but it stays within the north here, and the research is done here, so it impacts on people. And you've talked about all the charitable organisations, but actually even the cancer centre in Galvin, what they were able to do for my friend, and the support and all the holistic support that was provided was second to none. So in a very scary time for a young woman. So I think, thank you for raising it. It's really important, but thank you.
Thank you, Councillor McDade. So next item on Chair's business is Councillor Devine.
Good Chair, I'm not going to speak too long in this, just to raise awareness. It's Saturday, the 18th of October, is World Menopause Day. And I'm really delighted to see this year that the theme is lifestyle medicine. I think it's so important that we recognise and that we highlight the importance of simple everyday choices like healthy eating, physical activity, sleep and stress management, and that they can have really make a meaningful difference in how women manage their menopause journey. I think we all agree that much more could be done in terms of service delivery for the provision of women who are struggling with symptoms. But I would like to acknowledge the work that's done in the community and the voluntary sector and commend what they do in promoting these lifestyle factors and supporting women through their menopause journey.
Thanks very much, Councillor Devine, and I will concur with everything that you've just said. So we have the next item on the agenda for Chair's business is Councillor McDade.
Thanks very much, Chair. And I just wanted to take a very quick moment just to recognise a football club or a Gaelic club that has done really well. So Steelstown, my own club, so I don't know if I need to declare an interest or not, but just to congratulate our under-14 boys. Most of the team have been with us since their nursery school, so they've been there since they were kind of 4 or 5 years of age, and they've really come on. And I think this year especially they've done really well. They won the Martin McGuinness Chieftain Games for the second year in a row, and then they actually went on to win the A2 championship here in Derry, and it's the first time in the club's history that that's happened. And I think just to acknowledge that Gaelic football across the city has really come on leaps and bounds, and over the past sort of few years, Derry has always been, it's a soccer city. There's not a lot of kind of football in it or whatever, but I think the Steelstown's really been at the front of it and kind of pushing it forward, and other clubs now are coming forward too and doing even better. So I wanted to ask that maybe the mayor does a reception for the under-14 boys team, but also to wish good luck to the other teams in Derry that have big games coming up. I know Pierce's have a big match in the junior championship now coming up, and Shandolans, I think, have an under-16s big match for Derry as well. So all the teams are really, you can see they're all coming now. Historically, it was always the county teams that did better, but the city's coming now, doing much better. So I just want to congratulate them all and wish them well in their matches. Thank you.
Thanks very much, Councillor McDade. And the final item on Chair's business today is Councillor Boggs.
Good morning, Chair. I'll be brief for now. It's just to ask if we can deal with an item of Chair's business and confidential, following a discussion that I had with Karen today, and it's just in relation to DFC funding proposals for neighbourhood renewal, but there is an implication for staff, so I don't think it is right that we discuss it in open business. So with your indulgence and with the indulgence of the committee, if we can address that whenever we move into confidential business, please.
That's fine, yeah, no problem, Councillor Boggs. Thank you. Right, members, we're at matters arising from the open minutes of the Health and Community Committee held on Thursday, the 11th of September 2025. Now I'm having a deja vu. Any matters arising, members? Councillor McDade.
Thank you very much. It's HC 20725. It's just on the anti-racism. I just noticed today there was an attack last night in South Belfast on a young female student that has been racially motivated. The attackers were heard making racial slurs at her before they took a bottle to her legs. And I think it's important. We've spoken often in this committee and right across council about calling out racism, calling out any far right theology at all. So I just wanted to raise it when I seen it today. I thought it was important. I think that we have to continue to be that voice of reason and that voice of moral, like have that moral compass and call it out. So send our love and our support and well wishes to the woman who was attacked, but also call on everyone across society, but particularly political leaders, to have a strong voice on this. And there are some political leaders that keep using these terms like there's legitimate concerns around immigration, and we need to call that out and say, when you're saying that, you're giving cover to those far right people who are then out attacking innocent young women who are here to study and get on with their lives. And it just can't be allowed to continue. So I just wanted to raise it here, and thank you very much.
No problem, Councillor McDade. And I think the event we all attended last week, the Northwest Anti-Racism Charter launch, was a very significant event, and I think it sent a message across the whole community that racism won't be tolerated at all. And the endorsement of the actual charter is something that we can all adopt within our homes, within our workplaces, and indeed across the whole council district. So thank you for raising that today, Councillor McDade. Any other matters arising? Councillor Ball.
Thanks, Chair. 21125, and it's again Lakeland Dairies, Nerdy Garvin. I look forward to the committee where we don't talk about Nerdy Garvin. Well, we'll talk about Nerdy Garvin, but not Lakeland Dairies. Constituents have been back in touch again with myself, and I know other reps for the area that the issue has again raised its head. And I know from being through the area in the last couple of days, there does seem to be work ongoing. I don't know whether that plays a factor or not. And the smell, but the odor is still there. And I think until the issue is sorted out once and for all, it's important to keep raising it just for ourselves to be able to have it as a conversation point at this committee in particular. So I don't know if Seamus has anything to add in relation to complaints raised or anything like that, but for the time being, just to keep it on the radar and say that there are more issues and complaints coming through from residents.
Yeah, thanks, Chair, and thanks, Councillor Boggs. The council officers will continue to investigate odour nuisance complaints. We're also liaising directly with APRA, which is the regulator, and understand enforcement action is ongoing in relation to the installation. So we will continue to support both APRA and increase odour monitoring to try and resolve this.
Thank you, Seamus, for that update. Any other matters arising? Alderman Hussey.
Thanks, Chair, for the opportunity. As I said at the beginning, I'm not a member of committee. 204, the Northern Ireland Football Fund. And I'm probably being a bit on the edge on this one because members may have heard today that the executive are hoping to assist or looking towards the Women's World Cup that is upcoming and seeking to ensure that Northern Ireland can be part of the bid for hosting. I think it's the 2030 World Cup. I'm not 100% sure, that can be checked. We know the debacle that was around the Men's World Cup that eventually meant that Northern Ireland was not part of that application to host the men's competition. But I think we should be encouraging the executive to take this forward. Women's football attracts crowds, but not as big a crowds as the men's football, although they're getting pretty near it. And it gives the opportunity, if they're successful, for stadia throughout Northern Ireland, a couple of stadia in particular, to be utilised for fixtures in that competition going forward. And I would include within that the Brandywell. And that may be an opportunity for additional funding to assist the Brandywell going forward. So, as I say, I'm not a member of committee, but I would urge committee to support the executive in their intention to seek to be a host part of the nation for the forthcoming Women's World Cup competition.
Thank you, Alderman Hussey.
Right, correction there, I've just been corrected. The previous competition was the men's Euros, I think it was. This is the Women's World Cup.
Duly noted. Thank you, Alderman Hussey. Any other items under matters arising? That's grand. We will move on now to the.
Sorry, I do. Beg your pardon.
Go ahead, Councillor.
It's 204 slash. He's put me off. It's 204/25, the Northern Ireland Football Fund. Are officers aware that Derry City Football Club have began legal proceedings around the decision not to get funding from this fund? If so, what discussions have officers had with the club in relation to this, and what role does this council, for now, as the landowner, have in these proceedings? Because I think it's very important. I think it's a fantastic and a very wise decision by Derry City to do this. We would have preferred that the executive could have relooked at it and put plans in place to try and get that done. However, the petition was unsuccessful because others wouldn't sign it, but the club have now decided to take their own action, and I think this council needs to keep, at very least, a watching brief on those proceedings going forward. So I'd like to know what role, if any, officers had, and what role, if any, this council will have going forward in this procedure. Thank you.
Through yourself, Chair. Yeah, we had a meeting with the football club on another issue last week in relation to the Brandywell. It was nothing to do with their the pending judicial review. So the club chairman informed the chief executive and other senior officers that they were taking it. But the council has no role in this. This is a decision of the club. It's entirely taken by the club, and we won't have any. I know we own the Brandywell, but this is an application that the club submitted to the Northern Ireland Football Fund, and that's entirely up to the club. So the club council officers won't have any input into that at all.
And if required for support further on down the line, in terms of the judicial review proceedings, would that be something council would be open to, given the fact that our legal department in particular would have some experience in supporting council through judicial review proceedings? So that's something council are open to and looking at?
Through yourself, Chair, that's something we'll need to ask to our legal team, but it's my understanding the football club have appointed their own legal team and barrister team, so they're going down that avenue. So our lead legal service officer was at the meeting with Derry City, and there was no request for any assistance at all. It was just an information item really to let the council know that they were going down this path.
Okay, thank you, Councillor Tierney. So members, will move on to the agenda items, and we are starting off with agenda item 8, the age-friendly programme update, and that's Barry.
Thanks, Chair. Members, just to update you on the continued commitment and implementation of our age-friendly strategy and action plan, and to establish an age-friendly elected member working group and seek nomination from members to become age-friendly champions. Members, as part of the programme, an age-friendly working group will be established. As an internal working group, representatives from each party and one independent member will be nominated, and the working group will be supported by the age-friendly officer and the community development team. You'll see all of the initiatives members listed in section 2.6, and also for information, there'll be an age-friendly conference organised by the PHA on Tuesday the 4th of November, and the aim of this conference is to raise awareness of age-friendly NI and to showcase the excellent work of all councils who are delivering initiatives. The conference is also aimed at getting buy-in from agencies who may not have engaged in this process to date. So the recommendation is that members note the content of the report and that members approve the establishment of an age-friendly elected member working group and provide 6 nominations from members to become age-friendly elected member champions. Thank you, Chair.
Thank you, Barry. And Alderman McMorris.
Just a quick question, and this is not, I was just looking, is the working group, is that what the time is? Is that all the contribution that we would, I'm just seeing who would be most appropriate to sit on it, we work commitments, but is it just a working group in the conference and then whatever comes up after that? Is that?
Yeah, through yourself, Chair, there'll be the internal working group, the conference, and if there's any other initiatives that are council-wide, the age-friendly champions will be invited to that, but that'll be the time commitment, yeah.
So the working group is the champions.
Yeah.
When do you want
Now, if possible, yes.
right, okay, and then I'll nominate myself.
Thank you, Alderman McMorris.
Champion nominate Councillor Patricia Luke.
Chair, through you, I don't like volunteering people for. I'll nominate myself for now.
Derek, your party will confirm, but you just reach out to Barry with the nominations, and I suppose we can revisit that. And online, Janice has nominated herself.
He's not there.
He's not there. So anyone else who wishes to nominate somebody for that working group can contact Barry directly. Is that okay, Barry?
Yeah.
Thank you very much. Next item, members, is the Derry City and Strabane District Council consultation response to DFC support framework for independent advice and debt services, and that's Barry again.
Members, I'll take the report as read, but this is just to seek your approval of the draft consultation response. And I think the big point out of this, members, and those members that sit on the advice panel, the big thing from a council point of view is that you'll see in section 3.5, council welcomes a review of the support framework and recognise the potential to elevate all regions to a consistent and equitable standard of quality within the sector. This council has very much been at the forefront of assessing advice quality over the last decade or more. So it's anticipated the proposed enhancement will foster greater stability and long-term sustainability, particularly through the provision of extended funding periods. And furthermore, the integrated approach advocated within the framework is expected to yield improved outcomes for individuals that seek advice and support. So the recommendations that members approve the submission of the consultation to the AFC on the support framework for independent advice and debt services. Thank you.
Alderman McMorris.
Thank you, Chair, for letting me in. And just to declare an interest, I sit on the board of Advice Northwest. That's already noted anyway, should be noted. But I know we had a meeting there recently with the providers, and I know our consultation was shared with them. So I had a conversation with Advice Northwest in regards to it. So they thought that the response was very comprehensive, Karen. So thank all the team for that. They did make some kind of concerns in regards to the gateway service and, you know, whether it can be seen as totally independent and the impact that would have. Basically, it's the government looking at the government, you know, benefits and whatever. So there was concerns about that, and I just wanted to put on record to you about the collaboration working that already exists here. You know, our advice services is working collaboratively with the food banks and the social supermarkets and the community. So it's just, you know, reinforcing that collaboration. And I know we were talking about maybe collaboration and with the health services and the impact that has there. So I just want to put them things just to yourselves, you know what I mean? But the response is very comprehensive, and we felt that there was no real gaps in it. So thank you for that.
Next indicated speaker is Councillor Tierney.
Chair, thank you, and I'm happy to second the recommendation if Alderman McMorris has proposed it. And like Alderman McMorris, I'll declare an interest as well, as I sit on the board of Cairn Hall Resource Centre and the Advice Services Panel, both as council appointee. And I agree that the consultation response is very strong, and particularly when it's looking at quality of advice. I don't want to use the word three main, but the three sort of lead or long-term advice service providers across this district have been at gold standard for, I couldn't tell you how long, probably before this council was actually established, is how long our advice service providers are sitting at gold standard. Obviously, we have two new trial providers who have just come through the process, and I wouldn't imagine it'll take too long until they're sitting at gold standard in terms of quality as well. I think that's something really, really good, and the consultation response points out that we have been leading on quality advice, because if it's not good quality, it could get the person receiving that advice into a lot of financial difficulty. And that's why I think as a council we have to maintain the level of quality and ensuring that we are monitoring that on a regular basis, which I know we do. We're happy with the response. We're probably not happy with the level of funding that we get around advice services, and I have said that on here for probably before this council was established as well. That the one thing And the best thing that we can do, or that the government can do, to provide advice services for people who are struggling with their financial difficulties and having to go on benefits, or around mortgages and all of that, is invest in the sector, because that's where the people get the help and support that they need at the coalface. And if that money's not there and those services aren't able to run the way I think that they should run, that only impacts on our communities and the people who are struggling most. So whilst I support the consultation response, and every time that advice is being spoken about in this council, we will continue to raise the fact that we don't believe that we're getting enough money into this council area for advice. For example, there is, with the exceptions of some outreach work, if you want to call it that, there's very little advice being provided by this council in and around the Strabane area. There are very little, and I'm looking to colleagues across the chamber who would know better than me, there's very little in rural areas across this district, and that's because we don't have enough money. They look for organisations to provide that service. If we did, the advice sector across this district would be a lot better. But what we're doing for, and what the organisations, for the money that they're getting at the moment, is phenomenal. But it could be better with more investment from central government. Thank you very much.
Next indicated speaker is Councillor Harkin online.
Thank you, Chair, for letting me in, and I thank officers for putting together this draft response, because I think you've taken on board a lot of the issues that our providers have raised with us when they've met with the advice panel, which I'm on, and other councillors here are on, and a lot of the issues that we've raised ourselves. And I think that obviously there's a great need right now for independent advice, and we are rightly funding it as a council as needed. But as the response from the council points out, funding from government has been static for more than a decade. And I think that this is probably the greatest issue that we have to deal with. And it's the one that we've been raising as a council regularly with the Department for Communities. And it's the one that the providers raise regularly with us. So I think that in any consultation about refreshing independent advice services, the funding is the core issue. And I think that the funding simply is not enough right now coming from government. So if the government wants to see the delivery of services that match the level of need in our society, they actually have to increase funding. So that's very clear. And also the model of year-to-year funding doesn't work either, because it doesn't allow organisations that are doing great work, and I want to commend all our advice providers. It doesn't allow them to plan for the future, and it means that they're always thinking about how are we going to look next year. So funding is crucial. The other thing that the document talks about is the staff. And I think that we know from speaking to our advice providers that they are struggling to hold on to staff, and they're struggling to hold on to experienced staff, because there are better opportunities elsewhere with other organisations finding that they can pay people for doing more or less very similar work, but they can pay people better. And I think that this is a huge challenge for the independent advice sector. And again, it's not the fault of the provider, because it comes back to the scale of funding. And that's where we have to, again, so it's about people getting access to advice providers for desperately needed help. And then it's also ensuring that the advice providers are actually able to sustain themselves in the jobs. And this is a massive issue. So I think that has to come loud and clear to the department. I mean, look, they don't need a consultation to find this stuff all out. They already know all this. But, you know, because like the workers that we have in the advice sector that have an agreement with the council, they are working, you know, they're slammed every week, and they're constantly, you know, they're dealing right now with the migration over to universal credit. It's putting an immense strain on them. There'll be a new crisis next year that they're forced to deal with. So, you know, for the sake of the workers who are in this sector and for the people who are who need help, of course, the quality can always be improved. But I think the key thing right now is that people are maxed out in terms of workers and the capacity of the organisations that we're dependent on. So we have to fight for them. And I feel this document takes it to the department. So again, thank you to the officers who've put this together. I think it's a very hard-hitting draft. And I appreciate too that you've also integrated the discussion about the anti-poverty strategy at the end and the complete inadequacy of the anti-poverty strategy in relation to the provision of independent advice services. So this is a strong document that we're sending in from the council, and rightly so. Thank you, Chair.
Thank you, Councillor Harkin. We'll move on to next agenda item 10, consultation response to the Department of Communities. It's a public consultation on section 167 of the Charities Act, and that's Barry again.
Thanks, Chair. Members, again, I'll take this report as read to seek your approval on the draft consultation. I'm happy to take any questions around it.
Councillor Farrell.
Thank you very much, Barry, for bringing this. I'm happy to endorse it, and we all understand the reasons why it's needed and all. But as somebody is involved in charities myself, I know that the Charity Commission will keep an eye on any charities that do come in here. I know this is for specifically for charities that are set up in another jurisdiction, but coming in here. So I'm happy enough to endorse it.
Thank you, Councillor O'Farrell. Agenda item 11, members. It's the Strabane Local Growth Partnership change of lead partner for the End Violence Against Women and Girls Change Fund 2025 to 2026, and it's Barry again.
Thanks, Chair. Members, this is to update you on the change of the nominated lead partner for the funding programme and to seek your approval of the allocation of £8,000 to the Quorum Centre. So members, you'll recall back in March committee, we had agreed, or members agreed, that Fountain Street Community Development Association would be the lead partner. They've since in August this year written to us to say they're no longer able to carry that out. And following discussions held with the Strabane Local Growth Partnership, the board through consensus has nominated the Quorum Centre as the lead partner. So in terms of the recommendation that you approve the change of lead partner from Fountain Street to the Quorum Centre, including the issue of a letter of offer for £8,000 to the new lead partner. Thank you, Chair.
Thank you, Barry. Councillor Boggs.
Good Chair, and maybe at the start not to declare an interest as a member of the Strabane Local Growth Partnership, and if that's not prohibitive, then I'm happy to propose the changes agreed.
That's okay. Thank you, Councillor. Agenda item 12, food safety, the appointment of an additional public analyst, and that is Seamus.
Chair, I'll take the report as read, and I just want to seek members' approval to appoint a new public analyst to work on behalf of the 11 councils.
Proposed by Councillor Tierney and seconded by Councillor Devine. Thank you. Agenda item 13 is the Department of Agriculture, Environment and Rural Affairs dilapidation bill, and that is Seamus again.
Thanks, Chair. Members, this bill is a piece of legislation that has been referred to the Assembly's ERA Committee for scrutiny. The report outlines the purpose of the bill, including the proposed enforcement powers for councils relating to dilapidated buildings and dangerous structures. Members, officers from both the Building Control and Environmental Health Services have prepared a consultation response on behalf of Council, and this has been submitted subject to Council approval because the deadline was the 10th of October, and members are asked to approve the consultation response. Thanks, Chair.
Thank you, Seamus. Approved, everybody?
I have no issue with the response, and I know that it is already away on. I suppose for my own clarification, we are currently looking at the building on Pump Street, for example, Seamus. Would that fall into this, or would that be under different legislation? Because there has been some questions, particularly, I heard it on the radio the other day. It was first on the risk register, allegedly in 2005, I think it was. And there was questions being asked, well, if we've done the risk register in 2005, why was it allowed to get into even worse state of disrepair? So would something like this legislation prevent buildings getting worse? And could that, for example, have stopped what is currently happening now in Pump Street? Or is it completely different at all? Am I just as far out?
I suppose the brief answer, Councillor Tierney, is yes, the proposal would include buildings such as the one you're referring to, albeit in relation to that particular building, it's now being dealt with by the planning service. But in theory, yes, similar type of buildings could come under this bill, or this legislation.
I'm actually talking about before it got to where it's at now. If this legislation had been in place, the planning service wouldn't need to be dealing with it. Would that be, do you know what I mean? No, they wouldn't, because it would be, the building wouldn't have got into that state of repair. It would have been, there would have been a toolkit there to ensure that the owners are looking after the building and it wouldn't fall into that level of disrepair. Is that not?
Yeah, it probably, that particular case would involve both planning and building control from a dangerous structure perspective and what the proposal is for the building.
Thank you, Seamus. Councillor Harkin, is your hand up for this item, or was that from the last time?
No, that's for this. Thank you, Chair.
You're okay. So you're next up, Councillor Harkin.
Yeah, look, I think that this dilapidation bill is actually quite important because look, as a council, we have had the Austin building task force, and we've now agreed that we're going to expand that to potentially all the listed buildings in the city or in the district. So that is a serious bit of work. We also have the Fountain dereliction task force. We also have a housing crisis task force that looks at HMOs, and we also and within that is the issue of derelict buildings across the district. So there have been questions from stakeholders, councillors, aldermen, and other people who are looking at the overall picture of the state of buildings in the district from both a health and safety point of view, because Pump Street became a massive health and safety point of view. We're lucky nobody got killed by fallen debris. We're also looking at the issue of blight in our city centre, where buildings are allowed to just sit there and rot and kind of become a kind of emblem for some of the problems we have in the city. And then we have houses that are boarded up, or buildings that are boarded up in different communities across the city and the district for years and years and years. And it's a problem for neighbours. It's a problem for potential antisocial behaviour. And we need to have a proactive set of policies from government, from council, where we can intervene in a more straightforward way. Now, we've had some of these powers. I think there's been a tremendous reluctance to use them. And but I do think that hopefully this dilapidation bill will give us more clarity on how councils, even if it's not the council acting, but how statutory bodies and others prompted by the council can act to sort out these issues before it becomes a crisis, and to help us address the housing crisis by doing something with boarded up and derelict buildings. So I think it's important for the council to engage in this, and I'm glad we are.
Thank you, Councillor Harkin. And the next indicated speaker is Councillor Boggs.
Thank you very much, Chair. Just in relation to it, funny enough, after a year of being on council, I was asked a series of questions by a young person one time. One of them was, what powers would you want that council don't currently have? And I foolishly said regeneration powers for dilapidated buildings, so that we could do something about everything that is there now that's come in front of us. And it poses me more concern than joy now of what we might be left with, because there is a lot of responsibility whenever it talks about our track record as councils, or councils everywhere, their track record in being able to deal with the limited powers they have, and also doing a bit of reading of it, the lack of enforcement from the relevant department who has these powers that is looking to hand them down. And with that then comes the huge risk of, if we get ourselves into looking to progress a dilapidated building, whether that's through a legal route or whatever, and it talks there about, you know, the substantial financial risk could deter the use of powers within the Act. Is anything really going to change when you just hand powers that are already there to somebody else and maybe don't have the finances available to them to actually enact them? So I welcome the progress that it's actually being looked at, but I worry that it is being looked at and the here's responsibility and powers that we currently don't use, and we'll just hand them to somebody else, and they may not have the financial remit or capability to use them either, and comes with that a whole lot of legal ramifications about identifying somebody who maybe you think owns a building and taking them to court and all the rest, and it turns out maybe they don't own the building, or they don't have the responsibility anymore, or a lot of dilapidated buildings are in a state of dilapidation because they fell there when somebody perhaps went bankrupt at a certain point in time and all the rest, perhaps through no fault of their own, and all the negative, you know, connotations that has with that person. So I think it's in theory a very good act to bring it back to the fore that something needs to be done. I just await whether it's the right way of doing it, and I just want to put that concern on at the minute. I also would just query, I would imagine, I know it's the DARE committee are looking at this, I would imagine that they are going to, but do we have any idea have chief executives across the councils been engaged? I know this is our own response, but in terms of the fears that our own chief executive and our own senior officer team might have at this stage in relation to if this was implemented tomorrow, what position would that leave us on as a council? So it's just those kind of thoughts more than anything, but happy with the responses Councillor Tierney says right away. So, but it's just worrying that we may get ourselves into a worse situation than we're on at the moment.
Thank you, Councillor Boggs. And the next indicated speaker is Alderman Hussey.
Thank you, Chair. As the discussion has gone on, and particularly the last contribution from Councillor Boggs, I'm sitting here thinking, what difference will that make to the mill at Sion Mills, for example, which is in a state of disrepair because of ongoing vandalism, etc., etc. What difference would it have made to the Alexander House? What difference would it make to the mill in the Canal Basin, where, you know, there's considerable investment going to go in there, but there's one side of that overall area. So if somebody can, you know, in simplistic words, tell me what difference is that going to make, and what are the actions coming out of it? Similar to Councillor Boggs, if you take on responsibilities, you know, you just going to let things sit there, or are you tied into actually actions?
Through you, Chair, I suppose the consultation response, you'll notice that a lot of the questions was, do you agree or do you disagree? And a lot of the answers is no, we don't agree. And largely relating to seeking clarification on responsibilities, liabilities, cost to council, resources required, training, guidance, albeit the response also welcomes the introduction of fixed penalty notices, with a caveat that no, it should be at a level that it acts as a deterrent. So there's still a lot of questions to be answered, and we'll await the outcome of the consultation exercise. Thanks, Chair.
Thank you, Seamus. Councillor Tierney.
Thank you, Chair. And Seamus, I know that at this stage it's only a consultation response that we're being asked for, but my mind filters back to Department for Infrastructure, I think it was. No, it wasn't. It was your mucker, Danny Kennedy, at the time of the car parks, when they were handing them over to council. We didn't even get a say. We were just told they're taking them. And if we're being honest, some of them we didn't want because there was no budget in terms of repairs or maintenance or any of that. It didn't matter that we didn't want them. We were just, well, that's fine. You don't want them. You're getting them. and that was just the way it is. Is this the way this is going to be? Because as Councillor Boggs was speaking, you know, it almost sounds as if this is the department just looking to clear the decks. This is something that we can't do anything about. We don't have the finance to do anything about it. What are we going to do about it? I know we'll give it down to the councils and we'll give them nothing so that they can't do anything about it either. And we're sitting with a headache and not the department.
Through you, Chair, I suppose I can't preempt the outcome of the consultation exercise, but all those concerns are valid and have been raised, and I would imagine they'll be raised across the 11 councils. And just to confirm, I think Solus and the Chief Executives Group are aware of this consultation document and are being consulted on.
Councillor Boggs?
I just make the brief point as well after Councillor Tierney. I haven't arrived at a final position. That's not the final position that I have of the bill. It's just the worries that I have from the outset before I start pinning myself to a mask or saying that our party doesn't want it, because I don't know that for certain.
Thank you. So members, we're going to move on now into open for information. So we'll just go through them one at a time, and if anybody wants to speak on them, let me know. So the first item is the IPB Pride of Place Awards 2025, and Councillor Alderman Hussey.
Just briefly, I think this is tremendous that you know, there have been relative successes in the past, and again, there are groups prepared to go forward, and I was only just to wish them all the very best going forward in those competitions. With regard, I note in the financial concerns, their costs are covered. That includes them going to Limerick and being there for the presentation ceremonies and all the rest of it, I assume.
Thank you, Alderman Hussey. Item 15, grass pitch allocations 2025 to 2026. Councillor Boggs.
Chair, Chair, and Councillor Duffy had intended to raise this, but she's had to leave for another meeting. So just in relation to use the opportunity for the grass pitch allocations to put on record that it's disappointing that we haven't yet received a report on the capital sports grant, and whether or not officers can give us an update as to why we haven't received that yet and whether it can be brought forward as soon as possible.
There is a draft report. There's further technicalities being sought to make sure the position that we state is fully reflective of the nature of the schemes in other councils. So we would hope that that would be presented in greater detail than the draft sits at this point in time to your November meeting.
Thank you, Karen. And the next indicated speaker on this item is Councillor Tierney.
Thank you, Chair. And I suppose I'll declare an interest in this because there's a club that I'm involved with that are mentioned in it. There's no direct link, but they're mentioned in the appendices. But in terms of 2.5 of the report, Council has experienced growth in demand for allocations that cannot always be met. And that has always been the case year on year. But we're not told in terms of games or hours, for example, what can't be met. So what have we had to say, you know, when did we reach capacity and what was, for want of a better word, Barry, turned away? And in terms of what has been turned away, and I know that, and I've had this conversation with you, Barry, for a number of years around some clubs looking to develop their own pitch across my, I suppose, experiences across the Derry side of the council district, but I'm sure the same appetite would apply in the Strabane end as well. What, in your opinion, in terms of pitch availability, are we short at the moment across the council district? Because I think the last report that we got, if my memory serves me right, we were 12 football pitches short in terms of what we could fill. We also, due to lack of availability in grass soccer pitches, we don't allow training to take place on our pitches, which I understand because from memory, there's only 3 games to be allowed to play in the grass pitch per week to look after the pitch, etc., and that all makes sense. But when you're looking at, for example, preparation for the Foyle Cup and children at the age of under 11 are now playing the Foyle Cup on grass pitches. In preparation for that tournament, they have nowhere to train because council pitches, number one, don't allow you to train on them, and number two, be closed in terms of getting ready for the Foyle Cup coming. So there's a lot of, I would imagine there's a lot of hours throughout the year where council pitches are either not available or not playable. And we're still seeing in 2.5 that we experience growth in demand of allocations that can't always be met. So how much are we short, I suppose, is the question that I'm asking about, and how many pitches does that translate into? Thank you.
Through yourself, Chair, Councillor Tierney, that's not something without the information in front of me. There'll have to be an in-depth analysis. Members will be aware we had a previous pitches strategy where we looked at grass pitches across all our field-based sports and 3G training facilities. Big pressure was on training, which still exists and has been exacerbated, multiplied by 3. The growth of the female game across all codes, which has been absolutely first class, has put further pressure on the pitches, even though this council and other clubs have invested significantly. You know, if you look at what's going to be happening through Derg Active, what happened in the infancy of the council, in terms of Melvin Arena, in terms of what we're doing at the Daisy Field, in terms of the Brandywell, all of those things have happened, and we've still a huge pressure. In the last 18 months alone, the growth of female sport and also male sport, we had 1 senior team and now 3 senior teams. You'll see within the report, the AFA are, as members will be aware, always changing their ground criteria. So within our booking process, the higher the league you play in will very much determine if you get that pitch because it meets a certain ground criteria. We've also, within our booking procedure, if you're a local club or have been booking for 10 years, you get priority access. So we've had a discussion at senior level that we need to completely review our booking procedure because there are new teams, new clubs that are popping up everywhere, and they're not able to get proper access to council facilities because somebody has had 10 hours a week for the last 15 years. So it's something we need to look at. But in terms of answering your question, around grass pitches, if we were to, for example, put 1 play extra per week during the busy season, there's no guarantee that'll get us extra plays because the pitch is cut up. Will require extra maintenance and we'd end up shutting it for a period of time. So we may have to look at a trial and error at certain sites. And again, from a training perspective, I think I can't remember the number I gave previously around 3G pitches that we need, but that is further increased. But it is something the team will be looking at. But it wouldn't be a report that we're able to bring next month. We're going to have to do a full in-depth analysis of it. We have another problem probably that's not really detailed in the report. We have a lot of clubs who are coming to us and saying we want priority and nobody else at that pitch because we are now at a level. We have at least 4 or 5 clubs saying that, and we just never will be in a position to do that because of who we're going to decide to take away and put somewhere else. So we probably, hopefully before Christmas, if not early in the new year, bring a more detailed report back to outline all of this and who actually misses out. But it'll be a complicated report. That's it. Thank you, Chair. I think I've answered your question there.
Thank you. Barry, Alderman Hussey, you've indicated to speak.
Just very briefly, I noticed St. Swift's on there, and I also know that St. Swift's have ambitions with regard to the Brayfields and St. Bulls as a club. Are council officers helping them in any way to advance their hopes to progress that particular development within St. Bulls?
Yeah, just to confirm, we have met with the St. Swifts recently. We've agreed areas of support, and that included someone from our technical team, supported by sports development, doing a site visit a number of weeks ago. We're also advising where we can on funding opportunities, maybe smaller scale at this moment in time to help the growth of the club, but there is an open communication ongoing.
Very welcome. Thank you, Chair.
And the next indicated speaker is Councillor Boggs.
Very briefly, because Councillor Tierney covered a lot of what I was going to come back on after dealing with the capital stuff, but so I'll keep it for if we get a more detailed paper. But I suppose, how is there anything within that paper that does allow us? I know Alderman Hussey has talked about science buffs there in particular. Is there scope for more of that opportunity to try and enable clubs to get on their own 2 feet, basically, is what I'm asking. I know that there is always going to be a need for council facilities, but is there a piece of work to do in the future in relation to clubs becoming a bit more self-sufficient in relation to that they aren't all, particularly for soccer clubs, that, you know, that they aren't all reliant so heavily on our council facilities. It's good that our council facilities are busy, but it's getting to the stage, and the main reason I came on as well was to declare a similar interest to Councillor Tierney. I am heavily lobbied in relation to football clubs or sporting clubs getting time on Melvin Arena, and Melvin is the bane of its own success at the moment in some regards with clubs. So it's just in relation to that uplifting piece of work as well as part of any future strategy that we might have.
Through yourself, Chair, I know members may be aware there was a report recently went through ENR with regards to a soccer club in Derry. There was a MUGA, it's a 2G MUGA is my understanding, and they're getting a license or a lease around that in terms of access to that. So there are opportunities if land can be identified. The former Derry City Council and this council, indeed, you know, the Gaelic clubs came forward over probably 10 or 15 years and identified pieces of land and developed themselves. So if clubs do come forward with proposals, council officers we're open to those discussions and looking at that. The difficulty is, in the past, a lot of clubs have come and identified existing facilities where there are maybe 4 or 5 users or more, and said we would like to take that over that. Where, you know, how does the council then make a decision on that? But if it's an unused piece of land or land on a parkland or something like that, you know, we're open to conversations, and we have had over the last number of years with a number of clubs, but it hasn't really progressed as much in terms of as it did with the other sports.
Thank you, Barry, for that update. And the next indicated speaker is Councillor Devine.
Good Chair. I suppose just to raise the issue as well as the pitches, you probably know what I'm going to say, the change in facilities, that particularly for a club that's been lobbying me, they have the pitch, but they don't have the change in facilities to linked in with it.
Through yourself, Chair, that report, I would suggest when we meet with the team, we'll also be looking at our change facilities right throughout the district. It's been a highlight, and members will be aware we've spent considerable hundreds of thousands in recent years since pre-COVID and after, but a lot of those facilities are tired and actually coming out of use. So we'll include all of that in terms of where we think that needs to go over the next 7-8 years.
Thank you for that, Barry. Everybody okay to move on? So the next agenda item is agenda item 16. It's open for information as well. Department of Health, the Health Inequalities Annual Report 2025. No indicated speakers. 17, licenses and orders issued under delegated authority. 18, the Department of Health Learning Disability Service Model consultation. 19 is correspondence. 20, consultation. Sorry, Councillor Boggs, go ahead under correspondence.
Just under the CCTV one, just to note the response from the PSNI. I mean, I don't think it's anything different to what we were expecting, but we did have a rather lengthy conversation at that committee meeting in relation to all partners coughing up with what is needed to make sure that CCTV is sustainable in the city and towns and right across the district. So I think it's very disappointing, particularly when we see some of the stuff that money is being spent on at times, that this doesn't seem to be a priority. I mean, contributing £12,000 is pales into insignificance whenever you look at wider budgets and maybe what could a bit more do to help us in this area. So I just wanted noted that it is quite disappointing. Thanks, Chair.
Thank you, Councillor Boggs. And the next agenda item is the consultation list. Okay. And the last agenda item is the child's rights, and I'll just say a few words on that in relation to our recent recognition from UNICEF. We are now a child-friendly city and community, and I suppose it's a great accolade for the council to have, but we had an event last week through the local Democracy Week, where we had over 100 young people in the Guildhall partaking in a participation event in relation to how they see the outworkings of the child-friendly city work that we do. It was so inspiring to be sitting around those tables. They have so many ideas, but the work is only beginning. We will be revisited in 3 years' time, and we will see if we can remain to keep those badges. But just to say congratulations to the whole team. The work, the blood, the sweat and the tears that was put into getting that over the line was really, it was a large piece of work, and there had been a few staff members involved along the way, but just to have on record our appreciation for that work and congratulations to everybody that was successful. So thank you. Councillor McDade.
Thank you very much, Chair. And just to associate myself with what you're saying, just congratulations to the officer team about, I mean, we all know, well, I don't know if everyone knows how much work went on it behind the scenes. It was a slog. And I think that, was it 7 years? Is that how long it took to get there? You know, it's a long time to be working on a project, and even by council standards. But I think that it's just important to note all the, just to congratulate the staff and the partner agencies as well. But actually the young people are incredible. And that Have Your Say event last week, I went home and I was like, you know, and it sounds a wee bit corny, but like, the future's safe. If teenagers now are thinking the way they're thinking, and they have all the great ideas, if they're supported now to actually act on them and give them the kind of confidence to challenge things that they see that are wrong and have their voice, I think the world will be a better place in a few years' time. So thank you very much for all the work.
Thank you, Councillor McDade. Alderman Hussey.
So I'm going to congratulate all involved, but I think also to point out that it's the first area in Northern Ireland to receive that, and the second in the United Kingdom to Cardiff. So, I mean, it's quite an achievement in that way.
Thank you, Alderman Hussey. Can I have a proposer and seconder to go into confidential? Proposed by Councillor Devine, seconded by Councillor McDade.